Right, this week's question comes from a WhatsApp message asking, why do some people call addiction the disease of addiction? Now, just as a warning, I usually like to do these videos in one take because it keeps me brief and clear, and that's what I want. But this is a very complex topic, with a lot of moving parts, so there's going to be some cuts, but I'm still going to try to keep it to 60 seconds to a minute and 30 seconds. So, anyone who knows me knows I'm a really utilitarian when it comes to addiction treatment. Whatever works, whatever makes you healthier and happier, that's what I want for you. In the mental health world, there's all different movements. As they say, the road to hell is paved with good intentions, and most, if not all, of these movements in the mental health world are very much well-intentioned. One of these movements is the destigmatization movement, which is based on the theory that there are a lot of people who wait until it's way too late to get help, and they cause tremendous damage to themselves and to their families, and if we make it more palatable for them to go to get help, then they will do so earlier, and the cause of a lot of harm will be lessened. That's the theory. Now, I agree with that theory a lot, and I like that in principle. However, there's a lot of different tactics of how they went about making these campaigns. Some of them were more efficient and useful than others. Within the destigmatization world, there's people who refer to addiction as a disease and really push for addiction being a disease because they feel like you can't blame someone for having a disease, like it's not their fault. And if people who are struggling with addiction don't feel like it's a moral failure, they'll be more likely to go get help. Now, if you look at the actual classification of what is the definition of a disease, it's not very clear. The medical school people will very much comfort themselves that there is a clear definition, but that definition doesn't apply to all diseases necessarily. Same thing with disorders and syndromes. You have Down syndrome is very different than Tourette's syndrome. If you look at the world of disorders, there's a lot of disorders that you wouldn't think would be in the same category, like autism spectrum disorder and substance use disorder. Those are not very similar in how they're treated and what their presentations are, but they're both considered disorders. Same thing with diseases. A lot of diseases, there are viral diseases, there are non-viral diseases, there are genetic diseases. So you'll have a big section of people who are trying to be more empathetic towards the addict themselves, is that, it's not a moral failure, it's a disease. Like, you don't really have a choice. Like, you didn't choose to be an addict, like it happened to you, like cancer happens to a person. And then you have certain cancer patients or families of cancer patients saying, like, one second, my loved one has to go through chemo and you have to sit in a therapist's office. I think there's a little bit of a difference here. So there's a lot of fighting on different sides about whether or not it's a disease or a disorder. And my feeling is that there are definitely psychological and chemical and physiological things that happen during addiction. And the academic argument for why it's a disease is because it's a recurring disease with relapses. And then the argument to why it's not a disease is that it could be treated with just mental health, interventions. And it can be treated successfully that way. So if you understand where you are and why the feelings about whether or not it's a disease or not are coming up, you might have a little bit of information about why things are called a disease or not. Now, there's another whole subsection of people who will call it a disease, are people in the 12-step world who, in the big book, which is the foundational text of AA, which is the foundation of all other 12-step programs, the book called Alcoholics Anonymous has something in there called The Doctor's Opinion. I believe it's written by Dr. Silkworth. He talks about this thing called the phenomena of craving, which is what happens after you ingest alcohol, and he refers to it more of an allergy where you have a strawberry and you just have this unreasonable overreaction because you ingested a specific substance. He refers to alcohol with this thing where, and this is true chemically, where there is a real chemical reaction in someone who's addicted or dependent upon a substance, but sometimes even without even ingesting it, but just seeing it or thinking of it, there's real brain chemistry that's happening, and that brain chemistry changes the way of thinking and behaviors, and that's one of the arguments towards a disease. That's one part of this subgroup. And then the other part is people who feel because there's this phenomena of craving, therefore they can never take another drink again. And their motivation is this thing called, it's a disease. I don't have to think about whether or not I could or I can't handle it, just like someone who has a disease shouldn't be thinking about whether they could or can't handle another lapse into their viral infection. So that's why people call it a disease. Now you know. Some people don't like calling it a disease because they feel it's not empathetic towards people who don't have any behavioral changes they can make that would have any sort of impact on their disease that they have. And happy arguing. Enjoy the debate. Just do it nicely and be kind to everybody, please. And yeah, that's all I have to say on the topic for now.